Hello, my name is Alina Yemelyanov, and today I will be presenting on the topic of support and error analysis of difficult decisions in clinical medicine. We focus on supporting difficult decisions under uncertainty in clinical medicine to provide both patient-centered care and shared decision-making. Existing methods and tools for shared decision-making do not fully consider the patient's thinking model nor the patient's limited abilities. In fact, the decision-making process often remains problem-centered and has low patient involvement. Patients are often overloaded with information that isn't even entirely relevant to what they need, and it can be difficult for patients to fully grasp and understand all the information that is shared with them by their health providers. To provide shared decisions with patient-centered care, rationality should be determined. However, patients' and doctors' instrumental rationality is not yet recognized. We suggest the self-regulation model of decision-making under uncertainty, which operates under the principle of instrumental rationality and includes 8 core performance shaping factors, 4 core criteria of success, and 2 core factors of decision-making. Express Decision is a mobile application that supports this rationality. It is based on the self-regulation model of the thinking process and allows a healthcare provider to make patient-centered rational decisions. Problem-centered care involves decisions that are made on behalf of patients. Problem-centered decisions are those decisions that have a precise goal and limited time for execution. Health professionals must routinely rely on their intuition, knowledge, and experience, but they often tend to make error-prone decisions, especially when they have to make a decision quickly and rapidly. They also often tend to rely on heuristics, which are specifically designed to help make quick decisions on the fly. One of the most common heuristics, the fast and frugal tree, is widely used by emergency physicians to help make quick decisions. For instance, emergency physicians must decide rapidly whether a patient is at high risk for having a heart attack and thus needs to be sent to the coronary care unit, or if they are at low risk and thus only need to be sent to a regular nursing bed. Patient-centered care and shared decision-making are both highly ambiguous terms. The challenge of patient-centered care is to determine if and when this kind of care has actually taken place, as well as whether the patient was able to attain their personal goals. Surveys tend to be the primary way of verifying whether the patient is satisfied with the care that they have received. Shared decision-making involves both the patient and the health professional and helps in making a decision with the patient, providing information about treatment options, answering the patient's questions, and using decision aids. Existing models of shared decision-making do not provide sufficient support for the patient to achieve their goal. Thus, from this we can conclude that the objective mechanism of patient-centered care and shared decision-making should be clarified. Lack of instrumental rationality makes current shared decision-making models misleading. In existing shared decision-making, patients are overwhelmed with an excess of information from their healthcare providers. Cognitive limitations impact patients' working memory, so the information that they receive must be relevant specifically to their healthcare needs. Additionally, in shared decision-making models, decision support primarily relies on the use of multiple criteria decision analysis and decision aids. Multiple criteria decision analysis provides guidance to support healthcare decisions. However, it is limited to a problem in which both the goal and criteria are determined in advance. Additive MCDA models are compensatory in nature. Good performance of one attribute can compensate for the poor performance of another attribute. However, a disadvantage is that it is misleading in life-critical situations. There is also a variety of decision aids, including the Statin Choice electronic decision aid. Shared decision-making allows decision aids to become patient-centered when initially they were problem-centered. We suggest the self-regulation model of decision-making, which operates under the principle of instrumental rationality and includes 8 core performance shaping factors that are presented in the table below and that are divided into 2 classes, either information-based or energy-based. We have a systemic approach to define patient-centered care. We consider a problem-centered decision to be a decision that solves the problem. Decision aids are problem-centered. Problem-centered decisions become patient-centered decisions when the problem shares the same goal as the patient. Patient-centered decisions must be instrumentally rational, and they must also be shared with the patient. In the self-regulation model of decision-making, the goal, mental model, and level of motivation are formed in the process of decision-making. The principle of instrumental rationality that we suggest states that the goal of each subproblem should be a sub-goal in order to help reach the main goal. This serves as the main criterion for patient-centered care. The factor of difficulty plays an important role in decision-making, but it tends to be ignored. Difficulty is subjective complexity. Patients' difficulties are often associated with uncertainty, stemming from the goal, which is the primary factor of uncertainty. We have determined several difficulty-related performance-shaping factors in the self-regulation model of decision-making. There are also 3 levels of problem difficulty, including high difficulty problems, or HDPs for short. HDPs should be shared with the healthcare provider due to difficulties arising in generating hypothetical situations, evaluating pros and cons, choosing a new treatment alternative, and selecting a long-term treatment goal. Shared decision-making should be offered to support the patient in high-difficulty problems to provide patient-centered care. Express Decision is a web-based application. It implements the self-regulation model of the thinking process. Express Decision enables doctors to share goal-directed knowledge and information about treatment options to align with patients' goals, as well as to apply problem-centered decision aids. It also enables patients to implement their thinking processes more efficiently. Express Decision does not replace other tools and models. It can either be used as a standalone system or it can be combined and applied with decision aids. Here we present 2 hypothetical examples demonstrating the application of Express Decision in shared and patient-centered decision-making. The first example will be selecting the best treatment option for cholesterol reduction using the Statin Choice aid. The second example will focus on making a decision regarding care for an advanced heart failure patient, and this involves a very uncertain goal. The Statin Choice electronic decision aid provides a problem-centered approach for reducing cholesterol with the help of statins. It implements linear regression analysis to calculate a patient's current risk for heart attack or stroke. It uses 10 factors to determine this and recommends 3 different options. It is doctors' standard practice, usually, to recommend at least a low dose of statins. It is patients' responsibility to weigh their personal risks and make decisions accordingly. Express decision can support both the patient and doctor when applying the statin choice decision aid. Here, we have a hypothetical patient, a healthy man with a total cholesterol level of 280, which is considered to be high. When he applied each statin option to himself, he received the following results. Option 1, no statins. Option 2, standard dose of statins. And option 3, high dose of statins. The statin choice decision aid provides a problem-centered decision. How should we reduce the patient's heart attack risk by using statins? According to this, option 3 is the best. Of course, there is a trade-off between two risks: the risk for heart attack while avoiding taking statins, or risk for liver side effects while using statins. The factor of high quality of life serves as the main long-term goal for the patient to make a choice between either taking statins or not taking statins, along with alternative therapies such as lifestyle changes, diet improvements, or other medications. Considering these risks and weighing their pros and cons through a shared decision-making approach with Express Decision can help the patient obtain a patient-centered decision. Here we present a fragment of the decision tree for option 2, standard dose of statins, along with information and energy-based instrumental performance shaping factors and significance and difficulty-based instrumental criteria of success. Continuing with this example, our evaluation results from evaluating the hypothesis for standard dose works has pros at 50% and cons at 45%. Evaluating standard works is patient-centered because the principle of instrumental rationality is satisfied. In conclusion, Express Decision helps provide shared and patient-centered decision-making for cholesterol reduction. For the second example, we applied Express Decision to a case of advanced heart failure with two options. Either option 1, recommend end-of-life palliative care, or option 2, proceed with novel drug therapy. The patient's goal is to prolong the lifespan as much as possible, while also maintaining the best possible quality of life. However, this goal is extremely uncertain. This is a high difficulty problem that requires shared decision making. Express Decision helps to make a shared and patient-centered decision in which option 1 at 55% is more preferable than option 2 at 42%. Express Decision is helpful for error analysis. Express Decision supports instrumental rationality when a violation of instrumental rationality is the main cause of erroneous decisions. Emergency doctors' fast decisions are made without decision support tools, and thus tend to be error-prone. Here, error analysis is very practical. Express Decision saves the reasoning behind selecting different options, which allows us to determine repeated errors and their causes, error-provoking situations, and to provide recommendations. Thank you for viewing this presentation. If you are interested to learn more, below you will find references from our work, as well as our contact information.